Hi, I'm Kitty Lamprecht and I'm your physiotherapist. You're going to have a facetectomy to remove a facet joint cyst. I think before we talk about that, maybe we just need to talk about your back. So the movement in the back takes place over two columns. Your front column where your intervertebral disc is. So the intervertebral disc has got a ligament around it and a soft center. The soft center is like a gel, spongy type substance, and it acts as a shock absorber, but at the same time, it's also a way of giving nutrition to the cartilage and sustaining the cartilage. Then at the back, you have your facet joints. Now, your facet joints is small, but it's like any other joint. So it has a cartilage around it, and then a capsule around the joint in itself to keep it in place, and then it's got a fluid inside. As your cartilage deteriorates, it can cause a joint or cyst to form. Unfortunately, that cyst can narrow the canal where your nerve is running through, so the nerve going to your leg. That is why your leg is so sore. It can also, if it's left too long, cause damage to the nerve. So what is going to happen is that Dr. Lamprecht is going to go from the back and then open up a small window in the bone to get into the canal, and will then remove the cyst that's in the canal and make sure that the canal is nice and open for the nerve. So from my side, what is important is afterwards. So when you wake up, you are going to be lying on your back. You will have a catheter in, drainage coming out of the back, and also a drip. So you also feel that there's something around your legs that is pumping up and down, which is quite important. Those are compression as a compression device, and it helps with the circulation. We want you to lie on your back for at least 4 hours, and the reason being that the compression on the wound help to minimize bruising. During that time, you can move your legs, and in the next video, it's a demonstration of how you can do that. But a lot of patients find that lying on their back, their buttocks gets quite lame and sore. So you can lift up your buttocks, if that is possible. And that is also shown in the next video. It is after 4 hours that I think it's a good idea that you ask them to turn you. It is quite difficult, and with everything, the drain and the drip, assistance is needed to move all of those. So, but ask them to turn you. It will make getting up the next day much easier. It's also important that if you want to eat, because you cannot sit up, so the bed cannot be brought in an upright position for you to eat, it's best to either lie on your side, or if you're on your back, that the whole bed be tilted. Now, the nursing staff know this, but there's so many patients that sometimes forget what kind of operation you had. So it's quite important that you remember, and that warn them if they want to lift off the bed to help you, that you're not allowed to do that. So it's quite important that we stay, in a flat position. The next day, I will get you up, and then from then on, we will stand and eat, and you will find that movement will make things much easier. Lastly, it is quite important that your pain is managed. So back operations can be quite painful, which is to be expected. So if you are in pain, please ask for something, ask the nursing staff, and usually there is a number of pain medications prescribed, so ask for it, make sure that you have it and that you have a comfortable night. You're going to find that if you do, then getting up is much easier, and we heal much better. So I hope this helps, and I am looking forward to meet you.